Taxation of harmful and addictive substances has a strong track record of both curbing excessive consumption and reducing the deadly effect of these substances on our citizens. In December 2008, Nicholas Kristof wrote in the New York Times, "What was the biggest healthcare breakthrough in the last 40 years in the United States? Heart bypasses? CAT scans and MRIs? New cancer treatments? No, it was the cigarette tax. Every 10% price increase on cigarettes reduced sales by about 3% overall, and 7% among teenagers, according to the 2005 book, Prescription for a Healthy Nation. Just the 1983 increase in the federal tax on cigarettes saved 40,000 lives per year. In effect, the most promising cure for lung cancer didn't emerge from a medical research lab, but from money-grubbing politicians. Likewise, the best cure for obesity may turn out to be not a pill, but a tax." My partner has detailed several important facts, as well as the harms our plan addresses. Let me continue with additional evidence for the central role of sweetened beverages in the overconsumption of sugar, plus 2 additional facts which link in this way. Sweetened beverages provide most of our excess sugar. Beverage corporations use exploitive marketing, and taxation is an appropriate, effective tax response. Fact 4. Sweetened beverages provide most of the excess sugar. Sweetened beverages provide most of the excess sugar. Reporting in 2008, nutritionist Barry Popkins' book, The World is Fat, New York Times columnist Nicholas Kristof explained the danger. Quote, "Evidence is accumulating that sugary drinks are a major contributor. Except for soups, liquid calories don't register with the body. If you have a snack, even something unhealthy like potato chips, you'll eat less at your next meal. But have a Coke, and despite all those calories, you'll still eat just as much. Indeed, according to some studies, you'll actually eat more." Fact 5. Beverage corporations use exploitive marketing. Beverage corporations use exploitive marketing. A September 2011 article published by the CDC states, quote, "Food marketing targeted to children almost exclusively promotes calorie-dense, nutrient-poor foods and takes advantage of children's vulnerability to persuasive messages. Increasing scientific evidence reveals potentially profound effects of food marketing on children's lifelong eating behaviors and health," unquote. Beverage corporations are addicted to seeking their own profits ahead of societal good. They thus use deceptive marketing to drive the sales of addictive, high-profit sweetened beverages. Their influence in the marketplace makes healthier choices more expensive and difficult to find. And they promote bad science to bury the information which could guide U.S. citizens, and especially the poor and youth, to make healthier choices. Without government intervention, the problems will only grow worse. Fact 6. Taxation is an appropriate, effective response. Taxation is an appropriate, effective response. The same 2011 CDC article referenced in Fact 5 explains, quote, "Given the harmful effect of this marketing environment on children's health and the industry's reluctance to make necessary changes to its food marketing practices, government at all levels has an obligation to act," unquote. In summary, we believe the government has an important role to play in curbing any abuses of corporate interest which endanger the U.S. economy and its citizens. Now let me revisit our harms and advantages. Harm 1 revisited. Poor health and premature deaths. Poor health and premature deaths. According to the preliminary 2010 statistics published by the CDC, every single day, more than 2,000 people die prematurely in the U.S. from conditions arising from metabolic syndrome, heart disease, stroke, diabetes, and high blood pressure. A tax won't eliminate all of these, but according to Lustig and his associates in their 2012 Nature article, it would prevent an increasing number over time, starting with 9,500 coronary heart events and 2,600 premature deaths per year. Harm 2 revisited. Healthcare costs are high and increasing. Healthcare costs are high and increasing. A 2009 article in the New England Journal of Medicine, co-authored by the current director of the CDC, offers this assessment. Quote, "Medical costs for overweight and obesity alone are estimated to be $147 billion, or 9.1% of U.S. healthcare expenditures, with half these costs paid for publicly through the Medicare and Medicaid programs," unquote. A 2010 study at Cornell by health economist John Cable estimates, quote, the cost of a case of obesity among recipients of Medicaid, a taxpayer-supported program, is some $3,378, unquote. Advantage 1 revisited. Improved health and saved lives. Improved health and saved lives. The 2009 article in the New England Journal of Medicine, co-authored by Thomas Frieden, the current director of the CDC, reports, quote, in 2008, a group of child and healthcare advocates in New York proposed a penny per ounce excise tax on sugared beverages, which would be expected to reduce consumption by 13%, about 2 servings per week per person. Even if 1/4 of the calories consumed from sugared beverages are replaced by other food, the decrease in consumption would lead to an estimated reduction of 8,000 calories per person per year, slightly more than 2 pounds each year for the average person. Such a reduction in calorie consumption would be expected to substantially reduce the risk of obesity and diabetes, and may also reduce the risk of heart disease, and other conditions, unquote. Advantage 2 revisited. Healthcare costs reduced over time. Healthcare costs reduced over time. We have presented a variety of evidence showing that substantial health improvements would result from a penny per ounce tax on sweetened beverages. The 2009 New England Journal of Medicine article, co-authored by Thomas Frieden, reports, quote, the contribution of unhealthful diets to healthcare costs is already high and is increasing. An estimated $79 billion is spent annually for overweight and obesity alone, and approximately half of these costs are paid by Medicare and Medicaid at taxpayers' expense, unquote. So we see that health savings of improved public health will directly reduce federal expenditures for healthcare. Advantage 3 revisited. Increased federal revenue. Increased federal revenue. We have already quoted the CBO's estimate of $24 billion every 4 years from 1/4 of the tax we are proposing, resulting in an estimate of $24 billion every year. Based on estimates that this tax will reduce consumption by 15 to 20%, we adjusted the estimated revenue to $20 billion each year. The 2012 article in Nature provides a similar estimate. Taxing at a penny per ounce would provide annual revenue in excess of $45 per capita, roughly $14 billion per year. The negative team is asking you to maintain the status quo, letting beverage companies kill our economy and our citizens for their own financial gain. A negative ballot will result in escalating government expenditures for healthcare and 2,600 needless deaths each year. If we don't act soon, today's young people will become the first generation in the history of the United States to live sicker and die younger than their parents' generation. Your affirmative ballot endorsed the rightful role of government in protecting its citizens, especially our youth, the poor, and the uneducated, from exploitation by corporate interests. Don't give in to the intensive lobbying of the beverage industry. As your voting issues, we urge you to vote for saving lives, reducing government healthcare expenditures, and increasing federal revenue. A French tax on sodas took effect January 1st, 2012, and other countries are considering the similar legislation. The U.S. has the highest consumption rate of sweetened beverages in the world, and 3 times the obesity rate of France. The plan we have presented has been pursued in the state of New York and proposed to the U.S. Senate. It is supported by a long list of organizations including the American Public Health Association, the U.S. Conference of Mayors, the Center for Science in the Public Interest, the Physicians Committee for Responsible Medicine, and UC Berkeley's Center for Health and Public Policy Studies. However, implementation of this tax plan has been stymied by the beverage industry. Ronald Reagan said, quote, we must have the courage to do what we know is right, unquote. In this round, you have the power to do what you know is right, rather than bowing to beverage industry pressures. For this reason, we urge you to vote affirmative.